Billy Noble is a 44-year-old Hispanic male with a past medical history of hypertension who presents to the emergency department today with a complaint of it being hard to move my right side. Patient reports a sudden onset of right-sided weakness, facial droop, and slurred speech while sitting at his desk at work approximately 30 minutes prior to his arrival in the emergency department. Symptoms were initially severe, lasted approximately 15 minutes, and have since mostly resolved. Patient denies any headache, visual changes, change in level of consciousness, or similar events in the past. He reports no aggravating factors and sought medical evaluation immediately. Patient's blood glucose on arrival was 82 and his NIH stroke scale score was 0. Mr. Noble takes 5 milligrams of amlodipine daily for hypertension, but reports missing doses regularly. He also takes Tylenol occasionally as needed for pain. He has no known drug or food allergies. Patient's past medical history is limited to hypertension. He has no other chronic illnesses. He denies any major traumas, hospitalizations, or surgeries in the past. Patient's parents are both alive and well. The mother has diabetes, and his father has hypertension. The patient works as an accountant at a construction company and leads a relatively sedentary lifestyle. He is married and lives with his wife and 2 sons. Patient has a 20-year pack history of smoking, drinks 2 to 3 beers on the weekends, and denies any recreational drug usage. Patient also denies any depression, anxiety, or safety concerns. Review of systems was negative except for the transitory neurological defects described previously. His initial vital signs were as follows: heart rate of 74 and normal sinus rhythm, BP 149/70, respirations 12, temperature 36.5 degrees Celsius, and his BMI was calculated at 30.8. On physical exam, the patient had no signs of facial droop. His speech was clear. He had 5 out of 5 muscle strength in all 4 extremities. Cranial nerves 2 through 12 were grossly intact, and his balance and gait were normal. Initial differential diagnoses for Mr. Noble included stroke, Bell's palsy, and TIA due to the reported sudden onset of slurred speech, facial droop, and right-sided weakness. Bell's palsy was ruled out due to the presence of upper and lower extremity weakness and rapid resolution of symptoms. CVA was ruled out due to the rapid resolution of symptoms and a negative CT head, also negative MRI of the head and neck. The primary diagnosis for Mr. Noble is TIA. Transient ischemic attacks or episodes of neurological dysfunction lasting less than 24 hours as a result of focal cerebral ischemia or hypoperfusion without evidence of acute infarction. Common risk factors associated with TIA are diabetes, hypertension, smoking, obesity, age, alcoholism, unhealthy diet, stress, and lack of regular physical activity. Mr. Noble has numerous risk factors for TIA, which include poor compliance with the medical management of his hypertension, a 20-year pack history of smoking, BMI of 30.8, and a relatively sedentary lifestyle. The initial treatment plan for Mr. Noble includes administration of a loading dose of 300 milligrams of aspirin and 300 milligrams of Plavix, with subsequent daily doses of 75 milligrams of each for 21 days. Amlodipine will be increased to 10 milligrams daily for improved blood pressure control. Non-pharmacologic recommendations include smoking cessation, weight loss, and increased regular physical activity and exercise. Diagnostic tests performed include the CT head without contrast, 12-lead EKG, and MRI head and neck, all of which demonstrated no abnormal findings. The patient was provided education on signs and symptoms of stroke, the importance of physical exercise, smoking cessation, and healthy diet recommendations. Cultural considerations. Mr. Noble reports strong family support. I would consider enlisting his spouse in smoking cessation, medication regimen adherence, and lifestyle modifications. The patient was referred to neurology and encouraged to follow up with his PCP in 8 weeks. The patient was also advised to return to the ED immediately if stroke-like symptoms occur.